Hello and welcome back to Heart Attack Awareness, where we help you stay informed, stay safe, and protect your most important muscle, your heart. Hello and welcome back to Heart Attack Awareness, where we help you stay informed, stay safe, and protect your most important muscle, your heart. Today's topic is one of the most frequently asked questions during heart emergencies. Should you take aspirin during a heart attack? You may have heard that aspirin can save your life during a heart attack, but is that always true? How does it work? Who should take it and when? In this video, we're going to take a deep dive into the science, risks, and real-life guidance surrounding aspirin use during a heart attack. We'll also clear up common myths, share survivor stories, and walk you through what to do, step by step, if you or someone else might be having a heart attack. If you're ready to learn life-saving information, stay with me to the end, because what you learn today might one day save your life or someone else's. Let's begin. Aspirin is one of the most common and accessible over-the-counter medications in the world. It's known for relieving pain, reducing fever, and, perhaps most importantly, thinning the blood. That's the key to why it may help during a heart attack. Aspirin belongs to a group of drugs called NSAIDs, nonsteroidal anti-inflammatory drugs, but it's unique because it has antiplatelet properties. That means it helps prevent your blood cells, called platelets, from sticking together and forming clots. To understand why aspirin is used, we need to understand what's happening during a heart attack. A heart attack, or myocardial infarction, occurs when a blood clot blocks one of the coronary arteries that supply oxygen-rich blood to your heart. That blockage starves part of the heart muscle of oxygen, and the tissue begins to die. The longer the blockage lasts, the more damage occurs. That's where aspirin comes in. Aspirin doesn't break up a clot that's already formed, but it helps prevent the clot from getting bigger, and it slows the formation of new clots. Think of it like hitting the brakes on a runaway train. It can't reverse what's already happened, but it might slow it enough to give emergency responders more time to help. This is why most emergency medical protocols recommend giving aspirin to suspected heart attack patients on the way to the hospital. But here's the thing, it's not for everyone. Taking aspirin can be dangerous in certain cases. For example, if you're having a stroke, especially a hemorrhagic stroke, aspirin can make bleeding worse. If you're allergic to aspirin or have a bleeding disorder, it could be life-threatening. So how do you know if it's a heart attack? Here are classic symptoms: chest pressure, tightness or pain, often radiating to the left arm or jaw, shortness of breath, nausea or vomiting, cold sweats, dizziness or lightheadedness, and extreme fatigue. If you or someone nearby is experiencing these symptoms, especially more than one, call emergency services immediately. Then, and only then, might aspirin be appropriate. If advised by emergency services, here's what to do. Take 1 full-strength aspirin, 325 milligrams, or 4 baby aspirins, 81 milligrams each. Chew the aspirin, don't swallow it whole. Chewing gets the aspirin into your bloodstream faster. Avoid enteric-coated aspirin. It takes longer to absorb. Also, never take aspirin with alcohol, and don't chase it with soda or milk. Water is best. If advised by emergency services, here's what to do. Take 1 full-strength aspirin, 325 milligrams, or 4 baby aspirins, 81 milligrams each. Chew the aspirin, don't swallow it whole. Chewing gets the aspirin into your bloodstream faster. Avoid enteric-coated aspirin. It takes longer to absorb. Also, never take aspirin with alcohol, and don't chase it with soda or milk. Water is best. Let's look at what the American Heart Association and Mayo Clinic say. The AHA says, if you suspect a heart attack and are not allergic to aspirin, chew a regular strength tablet after calling 911. Mayo Clinic says, chewing aspirin during a heart attack may reduce clotting and minimize damage, but never delay medical care just to take aspirin. The key takeaway? Call for help first. Then consider aspirin, only if advised and you're not at risk of complications. Let's hear a real-life story. Dave, 58, was watching TV when he felt a strange pressure in his chest. He stood up and got dizzy. His wife immediately called 911. The dispatcher asked if he had aspirin and instructed him to chew one tablet. Paramedics arrived in 8 minutes. At the hospital, doctors confirmed it was a heart attack, but thanks to the aspirin and fast response, Dave's heart damage was minimal. Today, Dave says, that aspirin and my wife's fast thinking saved my life. Paramedics arrived in 8 minutes. At the hospital, doctors confirmed it was a heart attack, but thanks to the aspirin and fast response, Dave's heart damage was minimal. Today, Dave says, that aspirin and my wife's fast thinking saved my life. Now let me share one more story, this time with a different outcome. Maria, a 64-year-old retired nurse, was out shopping when she suddenly felt nausea, lightheadedness, and a dull pain across her upper back. She walked slowly to her car, sat down, and instead of calling 911, she decided to drive herself home. Once home, she remembered hearing that aspirin helps during heart attacks. She took 2 tablets and lay down, hoping the discomfort would pass. By the time her husband found her 30 minutes later, she was unconscious. Paramedics rushed her to the hospital, and though they were able to revive her, the delay caused significant damage to her heart muscle. Maria later admitted, I should have called for help right away. I knew better, but I thought I could manage on my own. Her story is a powerful reminder. Aspirin isn't a substitute for calling emergency services. Can help, but only when used in time alongside professional care. Maria later admitted, I should have called for help right away. I knew better, but I thought I could manage on my own. Her story is a powerful reminder. Aspirin isn't a substitute for calling emergency services. Can help, but only when used in time alongside professional care. Let's bust a few dangerous myths. Myth 1, you should take aspirin every day just in case. Truth. Not unless your doctor tells you to. Daily aspirin can increase the risk of bleeding, especially in older adults. Myth 2, you should take aspirin if you feel stressed or anxious. Truth. Stress is not a reason to take aspirin. Misuse can cause ulcers and bleeding. Myth 3, aspirin is enough, you don't need to go to the hospital. Truth. Aspirin is a temporary measure, not a treatment. You still need emergency care. In the past, daily aspirin was widely recommended, but recent guidelines have changed. According to the U.S. Preventive Services Task Force, people over 60 should not start taking daily aspirin for prevention unless directed. For people ages 40 to 59 with high heart risk and low bleeding risk, it may be considered. Always consult your doctor before starting a daily aspirin routine. The best way to avoid a heart attack: prevent it. Eat a heart-healthy diet. Exercise regularly. Avoid smoking. Manage your blood pressure and cholesterol. Reduce stress. Get routine checkups. Know your family history. Lifestyle changes are far more powerful and safer than relying on emergency medications alone. So, should you take aspirin during a heart attack? The answer is yes, but only if advised by emergency responders, you're not allergic, and you're reasonably sure it's a heart attack, not a stroke or another condition. Aspirin isn't a miracle drug, but in the right situation, it can buy time until professional help arrives. So know the signs, call for help, follow medical guidance, and always prioritize prevention over emergency reaction. If you found this video helpful, please like, comment, and subscribe to Heart Attack Awareness. We're building a community where people learn, prepare, and take action because every heartbeat matters. In the comments, let us know, have you or someone you know used aspirin during a heart attack? What did you learn today that you didn't know before?